Basic Pharmacology for 4th semester Faculty of Medicine. 1. Definition and scope of pharmacology. Definition of pharmacology. Pharmacology is the science that studies the interaction between chemical substances, drugs, and biological systems. Objective: to understand the therapeutic and toxic effects of drugs for safe clinical use. Branches of pharmacology. Pharmacokinetics focuses on how the body affects drugs, absorption, distribution, metabolism. Excretion. Pharmacodynamics studies how drugs produce effects on the body through specific mechanisms of action. Scope. Drug discovery and development study of mechanisms of drug action. Evaluation of drug safety and efficacy. Management of drug use in patients. 2. Pharmacokinetics. Absorption, the process of a drug entering systemic circulation. Route of administration influences the speed and efficiency of absorption. Oral depends on gastric pH, intestinal motility, and enzymes. Intravenous bypasses absorption, directly enters the bloodstream. Distribution, the drug is distributed to tissues through blood flow. Influencing factors: blood flow, organs with high blood flow, brain. Liver receive drugs more rapidly. Plasma protein binding. Drugs bound to proteins are pharmacologically inactive. Membrane permeability. Lipophilic drugs can easily cross the blood-brain barrier. Metabolism, the biotransformation of drugs into forms that are easier to excrete. Primary site, liver. Phase 1 reactions: oxidation, reduction, hydrolysis. Phase 2 reactions: conjugation, glucuronidation, sulfation. Excretion, elimination of drugs, metabolites from the body. Main routes: kidney, urine, liver, bile, lungs. Exhalation, skin, sweat. 3. Pharmacodynamics, mechanism of drug action, interaction with receptors. For example, beta agonists like salbutamol act on beta-2 receptors in the airways. Enzyme inhibitors. For example, aspirin inhibits the COX enzyme to reduce inflammation. Non-receptor effects. Osmotic drugs like mannitol increase urine excretion without receptor interaction. Dose-response relationship. Effective dose, ED50 dose that produces an effect in 50% of the population. Toxic dose, TD50 dose that causes toxicity in 50% of the population. Therapeutic index, TI. The ratio of TD50 to ED50, indicating the drug's safety margin. 4. Drug classification by organ system. Cardiovascular, antihypertensive drugs, diuretics. Central nervous system, antiepileptic drugs. Antipsychotics. By mechanism of action: enzyme inhibitors, ACE inhibitors for hypertension. Ion channel modulators, for example, antiarrhythmic drugs. By clinical purpose. Antibiotics for bacterial infections. Analgesics for pain relief. 5. Routes of drug administration. Enteral oral. Simple and inexpensive but influenced by first-pass metabolism in the liver. Rectal. Alternative for patients who are vomiting or unconscious. Parenteral intravenous, IV, rapid effects, suitable for emergencies. Intramuscular, IM. Slow absorption for drugs requiring prolonged release. Topical example, skin creams for dermatitis. Inhalation example, inhalers for asthma, providing local effects in the lungs. 6. Drug interactions. Pharmacokinetic interactions. Example, antacids can reduce the absorption of antibiotics. Pharmacodynamic interactions. Synergism. Combined drugs enhance effects, e.g. paracetamol plus codeine. Antagonism. Drugs that cancel out each other's effects, e.g., naloxone and opioids. 7. Adverse drug effects and toxicity. Adverse effects. Undesirable effects at therapeutic doses. Example, aspirin may cause gastric irritation. Toxicity, harmful effects due to overdose. Example, high doses of paracetamol can cause liver damage. 8. Pharmacogenomics concept. Genetic differences affect drug metabolism. Individuals with CYP2D6 enzyme mutations may metabolize drugs slower or faster. Application. Using drugs based on genetic profiles to optimize therapy. 9. Rational drug use. Selecting the appropriate drug based on efficacy, safety, and cost. Patient conditions, age, comorbidities, allergies. Avoiding excessive side effects and drug resistance, especially antibiotics. 10. Clinical case studies. Example cases. Hypertension. Choosing drugs like ACE inhibitors for younger patients but diuretics for elderly patients. Bacterial infections. Selecting antibiotics based on microbial sensitivity. Chronic pain. Combining non-opioid and opioid analgesics for severe pain.